Hello everyone, welcome to this video that is on driving and diabetes. What are the problems faced by the drivers who are having diabetes and what are the recommendation advices for those drivers? It is found that there are different levels of risk of accidents in person having type 1 diabetes and person having type 2 diabetes. Person with type 1 diabetes has higher risk of accidents with driving as compared to those having type 2 diabetes if even they are on insulin therapy. In recent studies, it has been found that individuals who are with tight control of diabetes, they have higher risk of road traffic accidents as they have higher chances of development of hypoglycemia due to the target of tight control of their blood sugar level. Now let's discuss what are the problems with drivers who are having diabetes. The first problem is development of sudden hypoglycemia, and the development of hypoglycemia is much common in patients with type 1 diabetes as compared to the type 2 diabetes, as in type 1 diabetes there is exogenous insulin therapy must be required, and sometimes this exogenous insulin dose may be unregulated, which causes sustained hyperinsulinemia and ultimately develops hypoglycemia, which can be a reason behind the accidents. The second problem may be the visual impairment in diabetes due to development of cataract or due to the retinopathy, and this cataract and retinopathy can develop with long duration of the disease. Other problems with the drivers with diabetes can be lower extremity complications in diabetes such as peripheral neuropathy, and sometimes they might go on through the amputation. To overcome this problem, we can suitably modify the vehicle for such person. Now let's discuss how the hypoglycemia affects the driving performance of any person. It is found that at the blood glucose level of less than 70 mg per deciliter, person's driving performance can be impaired. At this level of blood glucose, that is less than 70 mg per deciliter, the person may not even realize that he is having symptoms of hypoglycemia. This condition is known as hypoglycemia unawareness, where the person has reduced ability or failure to recognize the symptoms of hypoglycemia. This hypoglycemic symptoms can be in the form of impaired judgment, reduced insight, irrational and impulsive behavior. Some kind of mood changes can also be there in form of irritability and anger. Sometimes such hypoglycemic person can also develop impairment in the vision. Now let's discuss what are the conditions when a person with diabetes should not drive. If any person is newly diagnosed with diabetes and his blood glucose is not under control, and especially who are on insulin therapy should not drive. Any person who is developing recurrent daytime hypoglycemia, then he should not drive. If any person develops hypoglycemia unawareness, which we have already discussed, if there are reduced vision in both of the eyes of the diabetic patient worse than 6/12, if there are already development of severe sensoromotor neuropathy, if severe peripheral vascular disease have been developed in diabetic patient, or if any lower limb of the diabetic patient has been amputated. In such conditions, the person with diabetes should avoid the driving. However, in last three conditions, person can drive suitably when the vehicle is modified according to his disability. So what are the advices which should be taken by the drivers with diabetes? The drivers with diabetes should check their blood glucose before starting their driving. They should check their blood glucose frequently at regular interval during their long drives. They should take frequent rest in between and consume snacks or meals. They should also avoid the alcohol consumption during their driving, as it can lead to development of the hypoglycemia. They should always keep a supply of oral carbohydrate in their vehicle in case of any emergency use. If any person develops symptoms of hypoglycemia, they should immediately stop the vehicle and switch off the engine. After 60 minutes, they should check their blood glucose level. If it has come to the normal level, then they should start the driving again. Person with diabetes should stop driving immediately if any vision is deteriorated suddenly. Person with diabetes should always carry the identification card along with them, which indicates the medical status of having diabetes. Now we have come to the end of this video. Thanks for watching. Please like and share this video with others.